Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Mayank Jain with us. He's here to discuss about the career opportunities for the dental graduates after BDS, what all they can do if they want to stay in the medicine field, what all opportunities they can pick up, and also if they want to go outside medicine, they want to explore more in their life, there are a lot of opportunities that have an upper hand for them, and these are some of them that Dr. Mayank is going to tell us. So stay tuned for this amazing, interesting discussion. I'm sure you are going to get a lot of deep insights about something that you have never known. Welcome, Dr. Mayank, to the platform. It's really nice to have you here.
Thank you, Dr. Ayushi. I thank the Social Doctor platform for inviting me and having me to discuss my opinion on the career opportunities.
Yes. And actually, we are looking forward to the whole discussion. It's going to be a really interesting one. So can you tell us a brief about how has your journey been till now?
Yes. Actually, from the beginning, my dad has been posted in military training services. So I've done most of my schooling and all from various states in India. Thereafter, I did my graduation and MDS in orthodontics and facial orthopedics from SMS Medical College, Government Dental College, Jaipur. I did a course on cleft and craniofacial orthodontics from PGI Chandigarh. And I then, to diversify my field, because the thing is, we tend to skew our knowledge to a particular field. So I did start preparing for UPSC simultaneously, though I was posted as a government medical officer since 2013. But to diversify, I did that. And I cleared the prelims, writtens, and mains. I was in the waiting list in the IS, and I was getting allied services. I didn't switch over. So presently, I'm continuing with my job as a government medical officer and consultations in orthodontics. So
Wow,
I
that's
also,
yes.
I also intend to write a book on mental health management. So I've recently started writing also, and soon I'll be publishing it on Amazon. So
Wow.
that is.
That's really nice to know. That's a lot of things already that you have achieved. So let's get to the topic, and I'm sure you are one of those best people who understand about it because you have explored so much. So what are the career opportunities for the fresh graduates, the BDS, the who have just completed BDS? What all will you suggest?
See, while doing the undergraduation BDS, we often at least come to know whether we want to go for we want to continue in the same field or we want to switch over. So, firstly, we'll talk about some of the opportunities which are non-medical in option. So, uh, we can
Yes,
start with
yes. Some of the non-medical. Let's start with the non-medical one first. Yes.
Yes. So starting firstly with UPSC, it is a exam for the IAS, IFS, IRS, and IPS entrance. So the basically the eligibility criteria is 32 years for a general candidate, and but the thing is the subjects there are mostly the humanities subjects. There is a prelims examination which involves paper 1 of general studies and paper 2 of CSAT, which is the mental aptitude. And in the mains examination, there are 7 papers. The 4 papers of general studies, which includes the subjects of history, geography, sociology, political science, international relation, economics, environment, science and technology, ethics, integrity, and aptitude. And there is a subject on English comprehension. There is an exam on in English languages, English and any language, including Hindi. So these are the papers and you have got an optional subject which you need to choose. I had chosen anthropology because dental subjects are not there as an option. So I relate a bit to that field, and I had got second highest marks in the whole UPSC in the particular subject. So this is one of the subjects which people can choose, and there are other options also like zoology or psychology. These are other subjects which a person with a medical aptitude can which can help as an optional.
Okay.
So, and there is an interview stage in the exam, which consists of 275 marks. So this is the whole thing. The service, but the thing is, like around there are 12 to 15 lakh participants, and to get selected in IAS, you need to get a rank under 80, 75 to 80. So, and total overall allied services also the rank in under 300, all the services go. So I was around 400, 450. So that was a light service I was getting. And then there is option of the state PSCs as well, which if you are not able to go through the UPSC, there in different states, which has got an age limit of 40 years. So you can opt for the state PSCs as well. And the thing is, their syllabus is almost similar. And if by any chance, because UPSC has confined 6 attempts, and if your age limit crosses that, you start late anyways. So there's an opportunity to give the state PSCs as well.
Okay. Okay.
So coming to the second,
the UPSC and the state PSCs, then the second part of non-medical opportunity.
yes, that includes the MBA, in finance, marketing, or human resources. So there are certain colleges like IIMs, XLRI, ISM Hyderabad, which you can opt for, and you can also do it from Symbiosis Pune. So if you intend to, this is one of the options for MBA.
Okay.
The third option, which is included, is the coaching. Now, people have a passion for teaching. I've seen many of my friends and many of my juniors also, they are into coaching classes for the pre-medical. So you can either go for coaching classes in pre-medical like the Alan Akash and the Premier Institute. They pay you huge handsome salary. And then now because of the COVID, a lot of online thing is also going. Online teaching platforms have also come up. So you can try there as well. And the coaching industry is also for those who are not able to do their UPSC or PSCs, and then they can opt for teaching in that field as well.
Definitely, definitely. And this is a good option, which you can do with your clinics as well. This is one thing you can manage. And if you find your passion into teaching, you can pick it up full time.
Yeah.
Yes.
And as you mentioned that along with the clinic, so there is another option of solopreneurship. This is an upcoming option because things have gone online. And if you have any kind of skills, any soft skill related to your arts, craft, or you have some interest in shares, because you can make some courses on that. So it is a platform, online platform, where you can make your courses and then you can sell those courses. So for that, you need some email marketing. You need to link your account to your place where you intend to present your course. So there, and you can do some Facebook ads and Google ads, and then you can bring in traffic. So this is the upcoming option. And since the people have got a lot of free time presently in COVID, due to COVID, the patients have decreased. So you can input and divert your energy into this option as well. And you can, learn many things in this thing. In this field.
One more thing that I can add is with solopreneurship, it's not necessary to take it so deep of making courses. If you like drawing or you like making canvases, just start doing that. You can make videos of that, put it on YouTube, start your channel. Slowly, when you start building interest, you can start with classes also of that. Online classes have coming up for kids, of your age group people, of adults, and start charging for them. And then slowly, if you start, you really feel for that, you can go to the courses. So this is a journey, and it's all what you're passionate about. You can build your passion around that. That's really nice.
Definitely.
So these are the 4 points that Dr. Mayank has discussed in the non-medical thing, that is UPSC and the state PSCs, the MBA, this is core MBA, which is in finance, in HR, in management, in marketing, sorry. Then it is, the third thing is coaching for the PMTs, for where you can go for LN, Akash, and any other, institute that is teaching for the pre-medical examination, which gives you handsome salary. And the fourth thing is solopreneur. So these are the 4 things. Let's start with the medical part. What are the opportunities in the medicine if somebody wants to switch careers?
Yes. So the first thing is the post-graduation, of course. You do a master's, the MDS degree. You have all the clinical and non-clinical branches, as all of you must be knowing that. So this is one of the prime options, and you should target the NEET PG exam for that. and try to get a government college if possible, because like in 200 to 50 seats, mostly the government seats gets filled up because the competition is huge. And from a private college, it sometimes becomes difficult to get patients and all. So that is sometimes an issue. But if you have got good patient flow, you can definitely join any college as well.
Yes. Then the first is definitely MDS if somebody wants to go for masters. The second one, any?
Second would include going abroad. So initially people were more focused on the DDS and going to US. But the thing from past few years, it is becoming quite difficult. So the countries which can be targeted and which are easy are Canada, Australia and New Zealand, because if you cleared the NDEB exam of Canada, you are allowed to practice in New Zealand and Australia as well. But they have also got a series of examinations to clear, and you have sometimes to work. You'll have to work as an dental assistant for quite a few, quite some time. So if you don't intend to do that, you can also target Gulf countries. The process is comparatively simpler there, and there you need just you have to give one exam, and then you can practice your specialty exclusively by visiting multiple clinics, and that is a good option if you can stay in Gulf countries. That is one of the best options and very high paying.
Yes. Surely. So this is the second part, moving to any country or practicing in, in fact, I know some people who are practicing in Dubai on on part-time basis. They have their practices in India also, and they're practicing there also.
Yeah,
So
that is also there. Like weekly, you can go.
So you can opt for any of those. Then
particularly in specialties like orthodontics, that is very
definitely. Yes. So the third option, or what can be the third option?
You can, if you target government jobs and you find satisfaction in that, you can definitely give exams for the government medical officer, which is conducted by many states. Though UPSC also conducts the medical officer, but it is very rare and only a handful of seats are there. Only 2 to 5 seats are there in like 5 6 years, so that there's no point targeting that. But in the state PSC, like in Rajasthan, every alternate year we have exam, and there are decent amount of seats. Similarly, in Uttarakhand and UP, Gujarat, and MP, these are some of the states in the recent years where the exam is being conducted on a regular schedule. So you can target that. So because the thing is, the government jobs, it gives you a good salary and just at least a satisfaction, a security kind of thing. So that is, some people want that, and it is a good option.
When you are also practicing as a medical officer, firstly, what is the exam for a medical officer is like NEET, or it is something different? It must be on the same lines.
Yes, the exam is on the same lines. It is not a NEET exam. It is particularly conducted by the PSC of that government or the university. Like in Rajasthan, now the Rajasthan University of Health Science conducts that exam, and it is a 120 question online exam and MCQ based exam completely. And the 5 questions are of general knowledge also. And this is a non-interview exam, so it is very fair and transparent, and you can definitely go for it.
Okay. And when you mentioned that it's a high-paying job, when you are also practicing as a medical officer, can you please give an insight on that as well?
Yes, you are posted as a Group A officer, and in the like few years, you get a handsome amount of salary around 1.1 lakh. So this is a decent initial beginning, and there are 3 increments per year, and finally, it is salary-wise, it is okay. But work satisfaction, if you are posted in some rural areas, that is one of the demerits people might find, and you are not able to practice your specialty. That is also one of the reasons that people quit the government jobs and go into private practice. So the job satisfaction criteria is not fulfilled in all the places.
Okay. That kind of compromises you have to make. So now, what is the next opportunity?
The next is the Army Dental Corps, the ADC, which is initially it was on the basis of your final year marks, but now they have taken they've started it after with an exam, with the NEET exam itself, after the seats are filled, they take the army ones, they have their own form, and where they give a cutoff, and the students are called, and then there is an interview, and then there is a physical examination. So every year around 50 to 60 seats are there in Army Dental Corps, and you are posted as dental officers and in various parts of India. So that is also a good job if you want to serve in Army. So,
Yes. Actually, that also has a drawback that you get transferred here and
yeah.
there. But as it is a government job, it brings a good lifestyle with it, as he just mentioned, and good salary. So these are compromises that you make with a private and a government job. So what is
Exactly.
the next opportunity?
Now you can go for paraclinical courses.
Yes.
There's MSc in paraclinical and basic sciences.
Hmm.
So a lot of my batchmates also, they have done their MScs in pathology, microbiology,
Hmm.
anatomy, biochemistry, all these subjects, and then you get placed in government colleges. And if at all you don't get government colleges, you can tie up with many private colleges.
Hmm.
And in fact, you can also give your resume in various physiotherapy colleges. They also intend to take lectures for 1 to 2 hours. So like it's like you can go for in multiple colleges, and then you can schedule your lectures
Hmm.
and in the morning, and simultaneously, if you have a clinic or something you're doing, you can do your practice in the evening as well. So this is one of the good things that you can join multiple colleges with these paraclinical courses.
No, that's and how, if you have an idea, how do the colleges pay for the same?
Actually, since it is a if they pay less also, and you can take lectures in multiple colleges, so you get to earn a decent amount of salary, right?
Hmm.
It is not bound. You need to go from like 9 to 3, or only for 1 hour you can go, and you can visit multiple. If you are living in a city like Jaipur, or a bigger city, Gurgaon, and anywhere else, so you can tie up with many colleges. So that is
Yes, yes.
one.
So that is, and because you can also opt for colleges who are not paying you well, can you can look for opportunities. That's also very nice. Any other opportunity? Sixth opportunity, actually. What is the
Yes.
opportunity?
Then comes the MHA, the Hospital Administration,
Yes,
and the Health Management courses. This
yes.
is also a growing opportunity, and the placement rate is very high. Particularly institutions like the Tata Institute of Social Sciences (TIS), which is situated in Mumbai, and IIHMR. So these are the institutions which provide for these courses, and by and large, they have good placement rates. So this is one of the opportunities if you are interested in health management.
And actually, it increases your area of getting jobs and many opportunities. That's a very nice course to go for. So anything else that we can go for, a seventh opportunity that we can look for?
Yes, so you can go for some clinical research. In case of if you have some intention towards research, the CSIR and other institutions, they conduct some of the courses, and the placement in the pharmaceutical companies is now on a boom, because Indian pharma industry is much appreciated in abroad as well, because the rates of the drugs are comparatively cheaper and the recruitment is very high. So this is one of the thing after clinical research you can opt for. And then you can also go for the public health management,
Yeah.
which can be either after the MDS in community dentistry, you do MDS and then you go for it, or in case of abroad, like as we mentioned, doing some particular clinical course in abroad after clearing all the exams. Instead, you can also opt for public health, which is comparatively very easy to get, and then after completing it you get placed in some of the companies. They place you in conducting some kind of trials and research as a research assistant. So
Yes,
that is their
yes,
option abroad as well.
yes. And any other opportunity also to go for? Like,
Yes. Now, in case of if you are interested in forensic odontology,
mhm,
this is also an upcoming branch where different departments like Department of Anthropology, they recruit people for forensic odontology, and the like services like the police services, they are also have the affiliate departments along with it, allied departments, which take people from the forensic odontology. So that is one of the there. And then there is upcoming medical tourism,
Hmm.
Now, since the present in the present COVID times, people have less number of patients. So what you can do is you can upgrade your clinic by giving it a virtual presence on the by joining various social media, and you can make your websites, and you can start searching more about the dental and medical tourism, so that in the long run, if your clinic is on has got a good search engine optimization, and people, they can come, and later your clinical practice will also enhance. So this is also one of the options.
Yes, yes.
So,
So, there are a lot of opportunities that Dr. Mayank has discussed. So, in all, there were 10 career opportunities in the medicine field that you can go as a dental graduate that gives you an upper hand. First, he
yeah.
mentioned about MDS, that is definitely the masters in medicine in the same field. The second is go traveling internationally and pursuing dental, being a dentist anywhere in any other country. This is also one of the opportunity that you can look for, that gives you a settled life as well as a good handsome money in your hand. Third is medical officer that he's doing. He gave deep insight in that, how you can do it, as well as what kind of money you will get in that. Fourth is getting into army dental corps if you want to serve the army and serve the nation. Fifth is picking up any paraclinical courses, that for MSc in ANAT in physiology, which actually helps you to pick up lecturership in any colleges, any medical college prefer you as lecturers there because you have already done MSc in the same. Then it's MHA, where that is hospital administration, which you can pick up colleges to do, and it increases your horizons to get jobs. Then it is research based clinical research. Clinical research is a upcoming branch these days. There are a lot of opportunities in pharmacovigilance coming up, so this is something that you should explore. Then it is public health internationally as well as India. If you do the courses, there are a lot of opportunities that you can get. So this is also masters in public health is a proper course that you can go for. Then it is forensic odontology, where you do a course in forensic odontology, and you can be placed in jobs in police and some other allied branches where you are preferred because you have done that course and they need people like that. And then it is medical tourism. Medical tourism is something that I believe this is the best time that you can build your base in that, because you have time right now. And medical tourism is, India is a preferred country for medical tourism in the dental services. So if you build your online presence and build connects in some of the Gulf countries or African countries, you can get patients from there in your practices and build your income as well. So these are the
Definitely.
10. Yes, please.
I would also like to add that after going through the medical tourism, you can also start a startup, a rural health or an urban dental startup van or mobile dental van kind of thing. So it is like on if you want to widen your practice to a rural level and you have a broad mindset, so you can go for a startup. And there are various organizations like WHO and United Nations which fund for these organizations. If you have good scope and good view, the idea is good and you execute it well, so there are chances of scaling, and you can definitely think about it. Some of the people are doing, and this might be a good opportunity in the near future as well.
Okay. Okay. Any name that you can suggest if it's okay, speed that you just mentioned that some of the people are doing that people can get reference from?
Yes, Smile Express is one of the chain which is running. Then there is Smile Train for the cleft lip and palate patients. That is an organization which is going worldwide. So it has got branches in India. It has got branches everywhere. So these are the organizations which are grown up. So definitely people can go and search for that as well.
If you have a broader horizon to serve the the public in general as well as grow yourself, this is an amazing idea actually. So now when he has already discussed around 15-16 opportunities with all of those, I believe many people have got a clarity. Also, one thing I wanted to ask doctor, there are many courses that people can do to build their practical hand after their graduation, because that is very important in when you work in the private setup. So can you give an insight what kind of courses which you will suggest fresh graduates should do before setting up their own practice?
Yes. So the courses can be related to a particular branch, or they can be a general, the interdisciplinary courses. So
Yeah.
coming to the specific courses, like in endodontics, you need to go for rotary endo course. That is a must if you're a fresh graduate and you have not practiced it in your internship, because
Mm,
that is you don't have any option for not going into it.
mm,
Then there are courses on lasers in endodontics,
mm,
minimal invasive cavity preparation, and all those kind of courses.
mm.
These are the courses in endo you can go. Like in ortho, there are courses on fixed orthodontics. And if you are already established practitioner and you are doing fixed ortho, you can go for courses on the cleft lip and palate, and you can go for lingual orthodontics.
Yeah.
So that is there. In prosthodontics, you can go for courses on occlusion and courses on the full mouth rehabilitation, because these are the must the areas which are paying also, and then these are the ones which need to be incorporated at any. You cannot call, because this is not a time to call specialists for all kind of treatments, right?
Yeah.
So you have to enhance your skills and do maximum part on your own.
Mm,
So that is there. Now coming to the interdisciplinary courses, there are courses on facial aesthetics which are on boom these days,
mm,
and it is like, at least in the metros, it has got a wider reach. People are very careful about their appearance,
mm,
so that is there. And along with it, you can do courses on the hair transplantation,
mm.
which includes the PRP and other courses. The facial aesthetic course, some of the techniques included are the nasal rehabilitation, some kind of lip fullness procedures, facelift, eyebrow lift. So these are the procedures in that. So
Definitely.
these are some of the courses which definitely you can
Definitely.
opt for.
Actually, these are the courses that you can go for. Some of the courses that Dr. Mayank just mentioned, like for example, the rotary endodontics and the or basic ortho or something related to prosto, are something that will add to your everyday practice. But rest of them, you can actually analyze your kind of patient flow in your kind of area. What if, for example, if you're based in Bombay, you are based in a place where you're having high quality clientele, you should go for the facial aesthetics and the hair transplant course, because that can add your area of serving and build your build your practice flow and your money flow as well. So this is all about, depends on what you want and what kind of practice you want to settle with. But basic courses that he just mentioned, you should go for to have a better kind of practice. So doctor, one more thing I wanted to ask you for is, there, as you mentioned, that people should go for MDS. So somebody who wants to pursue MDS, anything that you can mention, good colleges that people can go for, a brief on that.
See, for the college, in terms of government colleges for MDS, I can say that GTC Jaipur is one of the best colleges for orthodontics. And because, in the first year itself, you get to practice lingual cases, cleft cases, aligner cases, which in most of the colleges, other colleges, you don't get lingual ortho. I mean, only 2 or 3 colleges in whole country, they allow you in during your post graduation. You need to do a special course there. So
Mhm.
this is one of the college. And then coming to prosthodontics, so Maulana Azad is one of the best colleges for prosthodontics. For oral and maxillofacial surgery, KGMC Lucknow, and Maulana Azad and PGI Rohtak. In fact, PGI Chandigarh has also started from past few years. So these are good colleges. In fact, GDC Jaipur is also one of the good colleges. Then coming to endodontics, most of the colleges have got good patients. And in fact, if you want to pursue MDS from private colleges, endodontics, pedodontics, and prosto, I feel these are the branches, because you have got good patient exposure in there as well. So you can pursue where the faculty is good. The number of PGs are less, because the lesser the number of PGs, more the patient's individual gets. So you definitely have to see the number of PGs, because some of the colleges have around 8 to 10 PGs. There's no point in doing PG from those kind of colleges, because you won't be able to get good patients. And unless and until you practice on patients, you are never going to improve your clinical skills.
Yes, 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 yes. That's really nice to know all of this. These are some basic things that you should go for. So doctor, we have got some questions that some questions that the viewers want to ask from you. Dr. Samishta has asked, how can we prepare for state PSC, the whole study style, and while being a PG student? She's a PG student right now, so how can she prepare for the state PSCs while doing her PG?
Yes. So can you please mention which state, any particular state you are aiming, or in general?
Dr. Samishta, if you are hearing, can you please mention any particular state?
I'll give a brief idea about the general preparation, right? So you can, what you can do, and you please mention your branch of PG also. Like most of the branches which are like endo, pedo, you don't have any
She's doing in
clinical.
She's doing in perio.
Perio, okay. Perio is also fine. You don't have, because in branches like prosto and ortho, you have work after your college also. So that is lab work, which the PG student has to do. But here you are free. So after that, what you can do, you can serve some online, because there are a lot of online stuff freely available for state PSC.
So
You can go on YouTube and you can check the course, because the subjects, as I had mentioned earlier, most of the subjects are that only. And there are few here and there. Some of the subjects are in some of the state PSC, they are different. So you can at least get a brief idea of all the material, the course material, and you can start reading on your own. If possible, you can join some online lectures at the night time. You can go through them. And state PSC is usually in 2 years, you get a job where you get an vacancy of 400 to 500 candidates. So it is, if you're aiming for a government job, and state PSC is definitely a good option. And during your PG, you can very well prepare for it.
okay.
You need to be focused. You can prepare definitely.
So she was asking for Uttar Pradesh as the state actually.
Okay,
So,
Uttar Pradesh. So Uttar Pradesh also, the system is similar to that of Rajasthan. It has got a bit lag, because the UPSC thing is, it is every year. There is no lag in the examination. It is a 1 year exam and 1 year of preparation, because the multiple stages exam. Similarly, the stages are the same in the state PSC also, but the vacancy comes in like 2.5 years. So that wait is there. But in that period, what you can do, you can apply for other state PSCs. So the cycle keeps on moving. If you get through it, it is very good. And if you don't get, you have other exams also going. So simultaneously, if you've got age limit, you can apply for UPSC as well.
So actually, Dr. Pooja asked the same question. Can other state students also apply for other state PSCs?
Yes. In Rajasthan, you can apply. In Gujarat, UP, Uttarakhand, you can apply. And for rest of the states, some of the states you need to search. Some of the states, like the southern states, they are very particular about the intakes. They don't allow, like Andhra Pradesh, they don't allow people from other, other states coming in, and JNK similarly. So you need to search for that on their website. It is mentioned, and then you need to prepare accordingly.
Okay, that's nice to know. Dr. Nikita is asking, how do you come to know about the availability of these government sector seats?
The government sector seats in the medical officer job, or in case of PSCs. Mostly you can buy nowadays, the online, there are many sources. If you follow any particular platform, they give notifications. So in case of UPSC, I can tell you, there are like Forum IS, there is some Insight IS. These are the, if you subscribe to their channel, so they will tell you that what all the exams are upcoming, what are the vacancies. So you get to know through YouTube itself. And there are newspapers also which publish, if you are, because for the government job exams, you need to go through newspaper on a regular basis. So that is, you will come across these vacancies, you will come to know. And be in touch on some of the groups on Telegram. Telegram is a very good platform. You can directly join. You can just type and search by the name of the groups, whichever subject you want to know. And there are multiple number of groups. You can just go on Telegram. Telegram is a wonderful platform, I must say that.
Okay, that's a deep insight to know. So Dr. Pooja is asking also, what are the credible sources of obtaining these paramedical courses? Any paramedical course? How can we do paramedical courses is something she's asking.
Yes, there is an exam for the paramedical courses also, like the MDS exam. There is an exam for the MSc, like MSc in pathology, MSc in microbiology, biochemistry, anatomy, physiology, and microbiology. All exams are there. There's a single exam for everyone, and according to your rank and according to your preference, you get the seats in that. And it is also conducted on a regular basis. Mostly every year there is an exam. In Rajasthan, it is there. In multiple states, the exam is there, so you can go for those exams.
Okay. Okay. So the government colleges do that, or private colleges also do this?
No, no. Yeah, private colleges. This was I was talking about the government colleges. In fact, private college you get because there are less number of people applying. So mostly people get the government colleges itself. They might not get their desired branch, but they definitely get some or the other branch in government college.
Okay. 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 So Dr. Malvika is asking, can we directly apply in colleges as lecturer after MSc courses, or we need to give any exams?
No, for the private colleges, you can definitely apply directly. In case of government colleges, there are vacancies, and those are interview-based vacancies. So there, you have to give an interview before joining.
Okay. Okay. So, this is it, doctor. I'm sure all of these all of our viewers have been really happy to know all the insightful information that you have just shared with them. This was really deep insight and deep knowledge that is actually very important. After you clear your graduation, people are tend to be very confused what to do, what to pursue, what not to pursue. And I know many people just get into peer pressure and do something that is not does not align with their kind of nature or their kind of work style, and hence they end up doing something that does not satisfy them. So just pick up what you want to do from all these career opportunities, what you feel is right for yourself, and pick them up and achieve what you want to. There is one more question. Dr. Aparajita is asking, can you please elaborate on getting into state government jobs as medical officers after graduation? What are the procedures for that? Is there written exams for that?
Yes, definitely. There is a written exam for that. That is, the syllabus is similar to that of the NEET PG examination. They have got questions from both the clinical and the basic sciences. And the exam is conducted on a 2 yearly basis almost from the last 10 years in Rajasthan. And it is also conducted recently in Uttarakhand. It was conducted in Uttar Pradesh. It is there like every alternate years, you mostly have in most of the states. So in Maharashtra also recently the exam, because of the COVID, there were many medical officers recruited. So it can be when they recruit for a contractual basis, there is no exam for it. But if they recruit for a permanent post, there is definitely an exam for it. And in some of the states like Haryana, there is also an interview associated with it. So that is a different story. We have to give the written and then you have to give the interview also for the final selection. But here in Rajasthan, there is no interview. So it is a very transparent exam and you can definitely go prepare for it.
Hmm. Yes, thank you so much, Dr. Mayank, and thank you so much, everyone, for viewing this. I'm sure it must be helpful for each one of you. And if you find this helpful, do share it with your friends and colleagues. Let other people also get a clarity in their life and achieve what they want to. So this is it. This is all we wanted to discuss with all of you. Thank you, everyone, for being there. Thank you so much, Doctor. It's because of you that we have been able to conduct this session and give such an insightful knowledge to everyone. In fact, Dr. Asif has just mentioned that you are modern day encyclopedia. I'm sure you are. You have, yes, you have given such a nice insight to each one of you to give to achieve whatever they want to in their lives. Thank you so much, everyone, for being here. Do follow us on our Instagram and YouTube channels as well. There you can find all our old interviews also, and all the upcoming ones will also be uploaded on these same channels. We are coming up with interesting interviews in the coming weeks on Wednesdays and Sundays. Wednesdays 9 p.m, Sundays 11 a.m. We go live every week, each time. So make sure to join us live for all these interesting sessions. So thank you so much for being there. Thank you so much, Dr. Mayank. Looking forward to all of you on Sunday as well, at 11 a.m. There is another interesting topic related to dentistry itself. So stay tuned and for that interesting session as well. Thank you so much for joining us at this time. It has been a bit long session now. Thank you so much. Good night, everyone. See you again on Sunday and in another interesting session. Thank you, everyone. Bye-bye.
Okay. Thank you.